he admitted that he acquired 7 prescriptions for Quaaludes to give to women that he wanted to have sex with. First of all, I don't know how he got them. Was this in 2000 or whatever this was? But describe to our viewers what Quaaludes do to people, Dr. Drew.
Well, it's extraordinary that somebody would prescribe Quaaludes at all, let alone 7 times. I'd like to know who these physicians are. After the 70s, they were essentially gone as a therapeutic medication. They're related to barbiturates. They're sort of an in-between category. The Valium-like drugs, the benzodiazepines, took over after that. But a Quaalude is a medication that causes memory difficulty, severe intoxication, sleep, and sort of an atonic muscular situation where people are sort of floppy. They can't really propagate through space very well. And you notice a lot of these women describe that. The other thing that was sort of extraordinary about the medications that they were exposed to is that they all described 2 or 3 sips and then whammo, they were out, suggesting that there was very high concentrations of something in those drinks. The other substance that has been implicated is GHB. That would have been later on in the course of all this. GHB is a common substance that gets in sort of date rape drugs or drug-facilitated sexual assault, we call that. Joan, whom we had sitting there, I talked to her earlier this evening on my program, and she says she thinks she was exposed to benzodiazepine, which is the Valium-like drug, and Quaaludes.
And Quaaludes. That's what I was going to ask you. Is it like a GHB, which is used in some instances for sex? Is this Quaaludes sort of a drug that is used for sex?
At one time it was. In fact, there's a lot of lore of people calling it something that was used for really drug-facilitated sexual assault in and around Hollywood in the 70s. It was something that was sort of in the culture at the time. And, you know, now we look at this with absolute horror, but I'm telling you, there was a cultural moment there that we need to take note of, and I trust the feminist scholars are getting their hands on this. When a woman can say she was raped, step up, tell her boss, and they told her to shut up. This is just unbelievable, the way we used to treat women, and this is sort of symptomatic of what was going on at that time.
You know, let's talk about his behavior. He's held himself up as a public moralist, right? Do you think he was clearly living a double life?
Well, not the first artist to do that, let's be fair. And you can't take away the impact his programs did, in fact, have. There was a positive impact of the programs on television that he was a central part of.
Does this negate that, though? All the good that you think came from that, does this negate it?
It doesn't negate it nor in any way measure against it. It's a totally separate idea that he was participating in productions that had very positive impact, and he may at the same time have been a serial rapist. I mean, this drug-facilitated sexual assault, he sort of fits a profile. A lot of them are older, in their middle ages of life. Sometimes there are accomplices involved in this, and I keep hearing that there were other men around sometimes when he'd offer these women drinks, so it sort of fits kind of a profile where men feel entitled, they want to be completely dominant over women, and that's, in fact, if indeed these allegations are true, what he was able to carry out.
Do you think that because people can tell themselves things over and over again so much so that they believe it, do you think that could be the case with Bill Cosby?
I think he was, you know, in a way that's sort of dismissing I forget the word, I can't find the word I'm looking for, but the depravity. It dismisses the depravity to say there was a cultural moment here. He was still depraved. Yes, there was a cultural moment. Yes, there was denial. Yes, there's a psychological process here. It doesn't make it not depraved.
We asked people on social media what they wanted to ask you, and overall, they said, how would you characterize Cosby's behavior?
Well, again, it's this drug-facilitated sexual assault, which is a syndrome that's not that well studied, it's not that well understood in situations like this when there's serial rape. I would call it, you know, people want to call it sociopathy. I can't really call it that. Obviously, I don't know this man, but you certainly see the narcissism operating, where you lose the capacity to empathize with your victims. Otherwise, how else could you possibly do this? And lack of empathy is the most serious liability associated with narcissistic personality construct.